Hello, this is Dr. Paul Ingmanson. I'm the director of the Sleep Laboratory Services at the VA Hospital in San Antonio, Texas. And I'm here today to talk with you about healthy sleep and how you can get the best rest of your life for the rest of your life. In previous sections, we've talked about sleep and sleep disorders. Today, I'd like to talk with you a little bit about what we call sleep hygiene. These are things that you can do to help your sleep without ever seeing a sleep doctor. So take out that pad of paper you've been using to keep your notes one last time. We know that sleep is affected by a variety of lifestyle factors, including diet, exercise, and substance use. Some of the factors are obvious, but some of them may be less than obvious. We know, for example, that caffeine disrupts sleep. Caffeine is all over the place in our culture. We're never more than 500 yards away from a caffeine distribution point. They're called Starbucks, and they're all over the place. Many people ingest caffeine on a daily basis. For most of us, caffeine will not disrupt nighttime sleep when we limit ourselves to a morning cup of coffee. But when we consume caffeine later in the day or in the evening, it oftentimes will interfere with nighttime sleep. In addition to being in coffee, caffeine is in a lot of other things that people consume every day. So, for example, consider energy drinks. Energy drinks have become a major industry. Americans spend an estimated $750 million annually on drinks like Monster and Red Bull. These products are loaded with caffeine, and people consume these beverages because they like the stimulating effects of caffeine. But again, caffeine has a relatively long half-life, and if you consume these beverages in the late afternoon or evening, it may make it harder for you to fall asleep and stay asleep. Generally, we tell people to avoid caffeine 4 to 6 hours before bedtime. For many patients, avoiding caffeine afternoon is going to be recommended in order to avoid caffeine's negative effects on nighttime sleep. There are other popular consumer products that may interfere with nighttime sleep, such as cigarettes, cigars, and smokeless tobacco. Everyone is aware of the health hazards associated with smoking in terms of the increased risk for cancer and heart disease. But in addition to increasing the risk for cancer, nicotine is a stimulant. Anyone who has ever smoked knows this. Nicotine is an alerting substance. When you inhale tobacco smoke or chew tobacco, you get a buzz. Many people smoke because they like the alerting effects of nicotine. People report that nicotine can help improve focus and concentration. If you smoke at night, nicotine is going to make it difficult for you to fall asleep. If you smoke in bed, when you do fall asleep, that could cause a fire, which is really dangerous for your health, as well as the health of other people in your home. So nicotine should be avoided 24 hours a day, but especially around bedtime, because the stimulant effects of nicotine will interfere with nighttime sleep. A heavy meal in the evening is generally a bad idea, but a light snack can actually be sleep promoting. It's hard to fall asleep when you're hungry. So if you're hungry late at night and you're having difficulty falling asleep, then a light, healthy snack may actually facilitate the transition from wake to sleep. A heavy meal in the evening is generally not going to be recommended as an approach, but a light snack may actually facilitate that transition from wake to sleep for some patients. Keeping a regular sleep-wake schedule is important. If you change your sleep time and wake time every day, that's going to tend to disrupt your sleep-wake clock. So here's a question to think about. On that pad of paper, write down which day of the week you think is going to be associated with the highest consumption of sleeping pills. What day would you guess? If you guessed Sunday, you would be right. Why is that? Well, people sleep a little later on Saturday and Sunday, and then Sunday night comes around and people have more difficulty falling asleep, and some may resort to taking sleeping pills. You can avoid that Sunday night insomnia if you maintain a regular sleep-wake schedule. If you change your sleep time and wake time every day, it's like giving your brain jet lag. It's confusing that sleep-wake clock in your head. You can avoid the Sunday night insomnia if you maintain a regular sleep-wake rhythm. Maintaining a regular schedule can be very important in terms of developing a healthy, stable sleep-wake rhythm. What about naps? I get questions about napping a lot. Is napping good or is napping bad? In general, my view is that napping can be a perfectly healthy habit. I have no problem with napping. I define a nap as 30 minutes to an hour of sleep, generally in the early afternoon. When we do tests of people after they've taken a nap, we oftentimes find that alertness memory, and concentration are all improved. So napping in the early afternoon can be a very healthy thing. If we look at different cultures, such as cultures around the Mediterranean, napping is a typical feature of the daily routine. If your schedule allows you to take a nap and you wake up and feel more rested after a nap, then napping can be a good thing and part of a healthy sleep-wake pattern. But if you find you have difficulty falling asleep at night, I may recommend restricting napping. Generally, we tell people to avoid napping in the afternoon if they have difficulty falling asleep at night. However, if you're able to fall asleep at night and you have the opportunity to take a nap during the day, there's nothing wrong with taking a nap, and the napping may actually improve your alertness and performance later in the day. However, a nap that's longer than an hour may disrupt your sleep-wake clock and interfere with nighttime sleep. Also, if you find that you have to sleep for more than an hour, or if you wake up from the nap and you still feel sleepy and groggy, that may be a sign that there's something wrong with your sleep-wake process, and you're not getting the restorative benefits of sleep. So if you find that your sleep is not restorative, that could be a good reason to talk with your doctor about getting a sleep test. But if you find waking up from the nap is associated with feeling more rested and you do not have difficulty falling asleep at night, then napping can be a perfectly healthy thing for many people. What about exercise? It's pretty unusual for a doctor to tell you exercise is bad for you, and many of us probably do not get enough exercise. Exercise, of course, has a lot of benefits for your cardiovascular health, but in addition to that, exercise may actually improve the quality and depth of sleep at night. If you can exercise, doing even mild exercise can result in improved sleep quality. If you can walk for 10 to 20 minutes, generally early in the day, with some light exposure, you can improve the quality and depth of sleep at night. Of course, you may want to take appropriate precautions to avoid ultraviolet light exposure that would increase your risk for skin cancer. If you could spend all day, every day inside without any sunlight exposure, you may end up sleeping during the day and staying awake at night, like a gerbil or some other nocturnal mammal. But if you can exercise and get light exposure early in the day, with the appropriate UV precautions, of course, you can improve the quality and depth of sleep at night. And that light exposure may actually help synchronize your sleep-wake clock and improve the stability of your sleep-wake rhythm. Some people may find exercising in the evening increases levels of arousal, and that may make it hard to fall asleep. If that's true for you, consider scheduling your exercise early in the day with more time in the evening for relaxation. Even if you cannot do vigorous exercise, light exercise such as a 15-minute walk early in the day with some light exposure can improve the quality and depth of sleep at night, and the light exposure may synchronize your sleep-wake clock and thereby strengthen your sleep-wake cycle. What about sleep and alcohol? It's not unusual for us to get questions about alcohol. Many people feel like alcohol helps them relax and fall asleep at night. Alcohol may relax the muscles and the nervous system and may help people to get to sleep more quickly. However, when the airway muscles relax, this can increase snoring, as well as the risk for sleep apnea. And alcohol tends to make you wake up more often. So alcohol, even if it makes you fall asleep more quickly, is going to cause more sleep problems rather than it solves. Generally, we tell people to avoid alcohol after dinner because it increases the risk for snoring and sleep apnea, and increases difficulties people have staying asleep and waking up refreshed. What about sleeping pills? Sleeping pills can help break a pattern of poor sleep, but they're seldom effective without other changes in people's sleep habits and lifestyles. For most people, if a sleeping pill is recommended at all, it will be recommended for short-term use. So, for example, if you have recently had surgery and you have difficulty falling asleep or staying asleep, then a doctor may recommend taking a sleeping pill for a brief period of time while you recover. Sleeping pills may also be recommended on a short-term basis if if you've had a major change in your life situation. But in many cases, sleeping pills will be recommended not for long-term use because the risks outweigh the benefits. Oftentimes, if a patient has a long-term pattern of difficulty falling asleep or staying asleep, sleep specialists may recommend alternatives to sleeping pills. Cognitive behavioral treatment for insomnia, or CBTI, is a program of guided changes in your sleep habits, your beliefs about sleep, and other features of lifestyle. And it's generally been found that the benefits of CBTI are more durable when compared with sleeping pills with fewer risks. So if you have a sleep problem that's associated with a short-term situation, such as recovering from a surgical procedure, a sleeping medication may be recommended for short-term use. But for the longer term, sleep specialists are generally going to look at helping you with changes in your sleep habits and lifestyle, and techniques that can help you fall asleep and stay asleep without the use of nightly medications. Okay, what are some other things that can be used to treat sleep apnea in terms of healthy sleep habits? We know, at least in some cases, that sleeping on your side can be important. When you sleep on your back, gravity is working against you. It makes your tongue fall back. It makes your lung volumes decrease. When we do overnight testing in the Sleep Disorder Center or at home, we oftentimes have a sensor that measures whether you're on your back or on your side. Some people only have breathing problems when they're on their back. And if that's the case, the doctor may recommend a very simple approach to treating the sleep problem, like avoiding sleeping on your back. Sometimes we recommend the use of a device like a Velcro belt with a wedge in the back designed to help people avoid sleeping on their back. Of course, some people will snore and have breathing problems in any position, and that's when we recommend devices like CPAP to help with breathing during sleep. But if overnight sleep testing shows that you only have breathing problems when you're on your back, or the breathing problems are worse when you're on your back, then avoiding sleeping on your back may be one of the recommendations for improving the quality of your sleep. Again, avoiding alcohol and certain medications may be important, as alcohol and some classes of medications may have negative effects on sleep. Losing weight can also be important. As we gain weight, the neck gets bigger and your airway gets narrower, and that can increase your risk for snoring and breathing problems during sleep. But the relationship between weight and sleep is complicated. The relationship works both ways. Not only are you at increased risk for breathing problems during sleep as you gain weight, but sleep loss itself can make people gain weight. Scientists have found that putting people on short sleep schedules, such as restricting sleep to 5 hours per night, can alter the hormones that control appetite and may make people consume more calories during the day. Losing sleep may make you tired and hungry, and that's a terrible combination if you're trying to maintain a healthy weight. So we have seen that sleep loss may contribute to weight gain, and we know that obesity can increase your risk for developing problems like sleep apnea. Can treating sleep apnea with devices like CPAP help you lose weight? Well, the answer is that there are no magic bullets, but if we treat your sleep problem, you may wake up and have more energy and be able to become more physically active. And longer, more continuous sleep may improve the regulation of the hormones that control your appetite. So if you have a sleep problem and a weight problem, then addressing the sleep problem can be a very important first step in helping you achieve and maintain a healthy weight. Increasing physical activity, along with developing healthy sleep habits, can help people achieve and maintain healthy weight. We know from many patients also that keeping your nasal airway open can be very important. For most patients, the obstruction that occurs in sleep apnea is below the nasal airway, in the back of the throat or at the base of the tongue. However, if you can't get air through your nose, it may make it more difficult to breathe normally during sleep. In some cases, nasal sprays or nasal decongestants may be recommended by your doctor to help relieve nasal airway problems that interfere with nighttime sleep. Nasal sprays and nasal decongestant medications are, in most cases, not going to solve the problem like obstructive sleep apnea by themselves, but they may make it easier for you to breathe with a device like CPAP. Heated humidification, which is available as a feature on most CPAP machines, can also relieve nasal airway congestion and help improve the quality of your sleep. So in closing, please take out that pad of paper where you're keeping your notes and write down 1, 2, or 3 things that might be interfering with your ability to get a good night's sleep. And finally, on your pad of paper, write down 1, 2, or 3 habits that you think you might be willing to try to help improve the quality of your sleep. Keep your notes in a safe place so you can review them from time to time and share it with your healthcare provider at a future appointment. So just to summarize, we know that our daily habits and lifestyle have effects on the quality of our sleep, and sometimes simple changes in behavior, such as changes in diet, activity pattern, and caffeine or alcohol use, can yield improvements in the quality of sleep. Learning about sleep can be the first step in improving the quality of your sleep, and getting the rest you need can improve your health, the quality of your life, for the rest of your life. So be sure to watch the other videos in the Sleep 101 series and check out additional sleep materials in the Virtual Medical Center Library. Thank you.